No, we are not yet live yet on Facebook.
Okay.
We're kind of a bit late, so.
Yeah.
We are live on YouTube.
We're live.
Live on YouTube and
Facebook.
And Facebook.
Okay, so we can proceed.
Yes.
All right. Hello, everyone. We quite have an international audience today, so good morning and good afternoon. I am 𝘿𝙗𝙚𝙪𝙪. I'm a third-year medical student at the Lebanese University in Beirut, and one of the two co-chairs alongside Monica Martinic in the Global Dandy Committee. And on behalf of my committee, I would like to welcome you all to our very first event and open discussion about overcoming obstacles, women in neurosurgery.
Monica?
Okay. Now I would like to introduce Dr. Salim Abdulrauf. Dr. Abdulrauf is a world-class neurosurgeon who specializes in skull-based neurosurgery and vascular surgery. He is famous for his two neurosurgical procedures that he himself has discovered. The first one is the Abdulrauf ICA classification system, as well as the Abdulrauf bypass. And my name is Monica Martinic, and I'm a first-year medical student from St. Louis University in the US. Welcome, Dr. Abdulrauf.
Thank you. Thank you, Monica. Thank you, Ahad. Thank you to our panelists. Thank you to all of our colleagues, medical students, residents, and neurosurgeons from around the world who've joined us today. It is my honor to open this session, our first session of the— Thank you, Monica. Thank you. Of the Walter Dandy Neurosurgical Worldwide Clubs group. I'm very proud of the people around the world, the medical students who have started this initiative. Just want to give you a little bit of a background as to how we got here before we speak to our esteemed colleagues who are the panelists on our webinar here today. I remember when I was a resident, and it was really, and all the panelists here know what I'm talking about. It is really a tough residency. That's something that everybody, all the medical students have to know. It really takes a toll on you, and it's so I believe it's the toughest residency there is in medicine to go through. I'll tell you an anecdote. My co-chief resident was, before he went into neurosurgery, he was in the US Special Forces. He was a Green Beret who had played a role in a number of operations for the United States in the Special Forces. One night, we were both on call at night, and we're just getting hammered. We were running 3 operating rooms, 3 in the morning, between he and I. And I asked him, I said, John, tell me, what's the difference between this and your life as a special in the Green Beret? He says to me, you know what, I'm gonna tell you one thing, because this was our last year of residency. He said, this is tougher than when I was in the Special Forces. I will be honest with you, this has been tougher for me. So I just want to give people a reality check as to, as we talk and we talk to our panelists today, the reality is neurosurgery residency is tough. And it's tough equally for men and women. And so it's tough for anybody going into it. So at that time, something really clicked with me, which really brings us to our session today. I had the opportunity to, we didn't have a large pediatric practice in our hospital where I was training. So I was sent to a pediatric hospital to work with a pediatric neurosurgeon because we supposed to have large volume, to finish our requirement. And I ended up in the hospital of Dr. Alexa Kennedy. Now, Dr. Alexa Kennedy is the first African-American neurosurgeon in the United States. I was a second-year resident. Actually, I was a troublemaker for her. She yelled at me a few times, and I deserved it. I'll be totally honest, looking back at it. But it really opened my eyes. We were having such a hard time, but I figured and it really clicked with me over the years I was a resident. It was so hard for all of us, but for women, it was even harder because they were provided obstacles that the men didn't have. So it really kind of clicked with me at that time. As hard as I was having it, for women, they had additional obstacles that I didn't have. So I really, at that time, this whole idea of what we developed in the Dandy Society about diversity, it started with me back when I was a resident. And I felt so harsh and so hard, but there are people who even have it harder than me. So I decided early on, if someday I get into leadership, I want to do something about this. And that's where this bug got into my head that many years ago. I was just talking to all the ladies here today are pioneers, another pioneer, Dr. Gail Russo, earlier this week, we were communicating, and she's the one who sent me this article that she published about diversity in neurosurgery, and she reminded me about Dr. Alexa Kennedy. And I think we cannot forget, as hard it is for us, it has been harder for many other people. And that's the truth about our specialty. It's a young specialty. It has very, very closed club, mentality for a long time. And it's important that we bring in, based on meritocracy, the best people we can bring into it, irregardless what their background is, what their ethnic or their sex or whatever. It should make zero difference. And we just want to bring the best people into it. So that's the lessons I learned. So when we started in the Dandy Society, as you know, we have chapters for neurosurgeons. When we started the clubs program, I had a group, what's called the Women in Neurosurgery Initiative within the Dandy Society, come to me and say, listen, you know what we're doing here. We are going to create the future leaders in neurosurgery around the world. The Dandy Society, where the leaders will come from because it's for young people. It is time to set this right. So for the officers and medical students for clubs around the world, we made the requirement that 50%, at least 50% of all officers of the Dandy clubs be women. That recalibrates the whole situation. Meaning, if we're setting the stage for future leaders around the world, we want equal opportunity for people. So it's not this backroom dealing what leaders become, but actually upfront, they are taught leadership and they're allowed to go into this in the future. So that brings me to the clubs program, which was based on that principle. So all clubs that are put this program together here today, you will note that at least 50% of their leadership is women, and which now recalibrates a long-standing problem we've had in neurosurgery. And many of these people on these leadership clubs around the world will be the next generation leaders in neurosurgery. So I think this is the right time. It's something I promised myself when I was a resident, and I decided if I don't live up to my promises, then I cannot be lecturing to other people about what to do. So this was something very important for me in my career to live up to that. And we have not gotten there. There are a lot of other people who will make it successful, not me. But I'm doing the part I promised myself that I would do. So without further ado, I want to go ahead and start official session with our panelists. We will introduce our panelists as we ask the questions. I will introduce each one of them to you as the questions come. Our two co-moderators, as you met, is Ahad and Monica. Ahad is from Lebanon and Monica is from the United States, the two medical students. So without further ado, so this is, we will start our formal session at this point. See here. So first, who's going to ask the first question? Monica, who's your first question to?
Okay, the first question is for Dr. Veronica Chang.
Okay, so let me just say a few words before you ask her a question. Give me the chance to say a few words, Monica, please. Veronica Chang is currently a professor of neurosurgery at Yale University in the States. Veronica and I go back a long time. I just had finished my residency in Michigan, and I drove across the United States. I remember that drive in my Ford Explorer across the country, and it was so rough. Now, my people in Michigan told me you finish on a Friday, and the people at Yale told me you start next day on Saturday, you need to be on call. So I drove all night long across the United States. And just to tell you the history of neurosurgery, okay, this would not happen today, But this, and I fought between the two groups. I said, listen, I have to go across the United States. The people in Michigan say that's not our problem. The people at Yale told me that's not our problem. You're on call your first day here. That was my first job as an instructor of neurosurgery at Yale. So I drove 12 hours all night long after I had been on call the night before as a chief resident Thursday night, okay? So just to tell you that what some of us went through. So I went to Yale and I met the group, and among the group, so as an instructor, as a young guy just starting out, your allies are the residents. Among the residents, it was a great group of residents. Among the residents was Veronica Chang. So Veronica was one of the first group of people I've ever worked with. Just finished my chief residency, just going on call. And lo and behold, Veronica is a resident with me, okay? So that relationship goes back a long time. Those are deep relationships that you never forget. So it is, I have not seen Veronica in a number of years, so it's great to see her today. So please, Monica, proceed with your question.
Okay. Dr. Abdulrauf mentioned that you began your residency at Yale when he began teaching as an instructor. What would you say are some of the challenges in residency and starting out your career as a female neurosurgeon? And was Dr. Abdulrauf nice to you and your fellow residents when he began teaching as an instructor?
Well, so thanks, Monica, for the question. And thank you, Salim, for inviting me here today. It has indeed been a really long time. And so it has been a long time because it's been a while since I've been a resident. And so I have gratefully, I think, forgotten a little what it's like to go through residency, except that I see it through our own residents. I think, and so, yeah, I really remember Salim arriving. He was a great fellow. We drank a lot and hung out on the weekends a lot. But it was really nice actually to have the comradeship. And so much as there are, as Salim said, there are lots of challenges through residency. I do think I'd like to emphasize that what Salim said, which is that you actually form some amazing friendships. These are people that you spend a lot of time with. You take care of really sick patients, and you bond. You learn to trust each other. You need each other at that time, and even outside of neurosurgery, you become great friends, and those friendships don't disappear over time. So much as there are challenges, there are really awesome things. So I'll tell you that the saddest day of my life was in fact the day that residency finished. So we rounded in the morning, and the usual chaos, and we're late for the operating room, and we've signed out all the patients, and then we're sitting in the back conference room and everybody disappears. And I'm left sitting there in the conference room with nothing to do that day. And I was like, crap, as bad as residency was, I feel so lonely today. It was the weirdest feeling. So anyway, so much as you have much ahead of you, and we'll talk about the challenges, I think that you should also try as much as possible to enjoy your time together in residency, because this is a really unique group of people that you spend time with. That you train with, that you'll always know the rest of your life, and they'll help you. So I think, though, the challenges of residency back when I was a resident were mostly just the hours and the expectation. So I kind of need a lot of sleep, and so I always felt like I was functioning at like 30%, which was just awesome. And then the expectation that, anytime that anybody calls you. And so I remember the worst was chief residency. There weren't any work hour restrictions at that time. it was Friday at 6:30 in the evening, and I was face down drooling on my sofa, and I got a call from my chair, and he was like, "I want a round. Where are you?" And I was like, "Yeah, this is not a pretty moment, but I'm gonna have to tell you, I will be there in 15 minutes." And I think so for me, that was really the challenge. I think I was just always tired. I don't think that I probably got out of residency as much as I could have because of that. The lab years, so we have in our program 2 years in the middle with lab, and so that was really helpful. It was nice to be able to catch up and kind of gain some knowledge and things like that. But I have to say though that that all that running around, functioning at 30% was great training for junior attending hoods. So so keep that in mind. It doesn't necessarily get better after you're done with residency. I think the other challenge when I was going through residency was that there just weren't a lot of women in neurosurgery. And so that has really actually changed significantly in our program today. We are about 50% women now. But the other part of it was kind of the whole impression of how women were expected to do in neurosurgery. And so I think that there was very much a feeling that if you were a woman in neurosurgery, that you weren't going to be technically or academically as successful as your male colleagues. And that, you know, you would go into something that was adjunctive rather than mainstream neurosurgery. And so unfortunately, I probably proved everybody right. I went into Gamma Knife. You know, that really helped me actually with kind of raising kids and you know, having a family and stuff like that. But I think that we got to start somewhere, and I think I'm hoping that obviously our female residents today, you know, will choose specialties just like, you know, equivalent to our male colleagues. But for me, I think those were the two biggest challenges.
Well, thank you. Thank you for those words, Veronica. We are proud of you. We're proud of you. You are one of the best residents I've ever seen. And you could stand up to any male colleague any given day. And but as I said, all of you guys are pioneers and you have set the stage, you know, for the ones who come after you. And clearly we have a resident on the panel today as well. So we're going to be very interested to see her input some years later after you and I finished, as to with the change in the resident hours and everything else, how the experience has changed. So we will be very interested in Nan's opinion as well. So thank you very much, Veronica. Next question will come from Dr. Ahad. Who's the question to?
The next question is for Dr. Catherine Mazzola.
Okay, thank you. Ahad, give me 1 second. I'd like to just say a word. Like Veronica, I have known Kathy Mazzola for a long time, from a different part of my career. We both were on the executive committee of the Congress of Neurosurgery, the CNS. The CNS is has always traditionally had younger leaders to define leadership in the United States. And both Kathy and I were on the executive committee together. So we served for a number of years together. One thing about serving on an executive committee together, as the club officers of the Dandy now are finding out around the world, you really get to know each other. We get to know each other very well. So I got to know Kathy, and it was a great privilege for me. Kathy comes from the East Coast of the United States, from New Jersey. That's where she went to school, did her residency, and she is a renowned pediatric neurosurgeon in the United States today. She has a pediatric hospital. She's a faculty member at Rutgers Hospital. So it is a really great pleasure to see you, Kathy, and see your success. Please proceed with your question, Ahad.
Yes. So, Dr. Mazzola, according to you, why are female medical students around the world much less likely to select neurosurgery and pursue their career in the field? And how do you think we can change that and make it better?
Thanks, 𝘿𝙗𝙪, and thank you, Salim, for asking me to talk today. So, first of all, I mean, we all know that neurosurgery is a very demanding residency and a very demanding career. So for some women, they just are not interested in the challenges that are owned by our specialty. And for many women, they don't have a role model. They haven't seen what a female neurosurgeon is and what a female neurosurgeon can do. Many people have a preconceived notion that all neurosurgeons are older men wearing bow ties. And obviously we're all here to prove that that's not true. Many people have a preconceived notion that neurosurgeons are stuffy old men who are no fun, and that the few women that make it through neurosurgery have no families and no real life. So, you know, the senior female women in neurosurgery, I think it's part of our responsibility to prove that this isn't true. So I can tell you I have 5 children. I'm 53. My oldest son is 33 and he's married, and I'm a grandmother. My youngest daughter is 13. So obviously I have a family life. I am what you would consider private and academic. I do have an academic appointment, but I started my own private practice. Initially, I was part of a big male private practice. I was the only woman and the only pediatric neurosurgeon. So I wanted to start my own pediatric neuroscience center. So I started that. So we work with neurologists, pediatric neurosurgeons, pediatric neuropsychologists, so pediatric developmental specialists. So it's sort of one-stop shopping. But I think a lot of young women who are smart and brilliant, they develop something called like this imposter syndrome, where you can't see yourself being that person, being that female neurosurgeon. You need to, it's very hard, but you have to look for women or a good mentor who you can identify with, who will continue to support you as you grow up and go through medical school and then go through residency. So it's really important to find a good, strong female mentor who will be there for you, whether it's through emails, through a quick Zoom chat, or through something, someone who gives you the opportunities. Because a lot of women in medical school and even in residency, they weren't given the same opportunities to do research, to have different letters of recommendation and phone calls made for them. And some of, you know, very often women, especially I think in neurosurgery and other surgical specialties, it's almost like this silent social exclusion. You're there in the department, you're doing the work, but later you hear that all the guys got together at a cigar bar and they were talking about different research they were doing, and no one even invited you, you know? So it's that kind of, you know, exclusion. Those opportunities have to be opened up for all women, you know? So we have a lot of work to do still for medical students and female residents.
Well, Kathy, great words. You know, we have seen exactly what you were talking about. I saw it throughout my career. Everything you said, I've seen it, okay? We are so proud of you and proud of your success. You show us what pioneering people can do despite the difficult environment. So you attest to the spirit that really is needed to succeed. And I hope the medical students, and I'm told we have hundreds of people watching this session from around the world, that will know that you can achieve what you want, and you have heroes in front of you right here who've shown what it can be done. So it's great, and we are so proud of you. Thank you. Next, Monica, who is your question for?
Yes, my next question is for Dr. Tatiana Vilas-Boas.
Monica, allow me to say a few words about Tatiana. This is such a great session for me. I never thought it would turn out this way. It reminded me of different parts of my life. And Tatiana, just like with Veronica and Catherine, I've known her a long time. Tatiana came at a different part of my life when the Dengue Society became a global organization. Tatiana became the first General Secretary of the Dengue Society globally. From Brazil, she represented, was very important for the board of directors, which really was, a bunch of these old men, backroom kind of dealing men. It was very important for this more progressive thinkers that there be a female represented up front of this newer society. So I got to know Tatiana very well. I actually got to know her like family. Her two sons, Alto is now 12 and Nitor is 8. Her husband is a general surgeon, bariatric surgeon in Sao Paulo. I got to meet her parents when I visited Brazil. Tatiana and I have been in our global roles of awarding the Dengue Medal to a number of people around the world. We've traveled together to all over the world. I mean, Asia, Europe, South America, North America. So I've gotten to know her very well, and her career is also an exemplary example of what people do under difficult situations to really seek the ultimate, to seek excellence itself. So it's great to see Tatiana with us here today. Please, Monica, proceed with your question.
Thank you. Dr. Tatiana Vilas-Boas, can you share with us how you've been able to balance having a difficult career in neurosurgery as well as having a family?
Actually, my story is quite different. I got pregnant during residency program. I was in the second year, and I decided to keep my child and keep the residence. Actually, I had a very peaceful and helpful pregnancy, and I could do my job. Until the end, I did. Actually, in Brazil, things are a little bit different right now, but at the time, we don't have many hours that you to rest. So I give 72 hours on call. And my son born on the weekend, Friday, Saturday, and Sunday. And my son was born in Monday. And I get out the same operating room, only the difference of neurosurgery part or NGO part and obstetrician part, and he was born at the same hospital that I was doing my calls. I don't know if we have really a balance. Actually, I do know that I really like what I do. I really like to take care of my patients. I really like to be a mom of two really beautiful boys. And sometimes I need to do things that give preference for one thing and then give preference for other thing. And I really like my family really supports me, and they travel with me like, oh, we're going to have a congress this year, so we're going to travel to that place. So many times I took my children, my family, my husband, my mom with me to congress, and children, actually, they have a really great time doing that. They have seen conference before, and they stay quiet sometimes, and I have time to go to the pool with them after that. And I really don't know that we have a balance, and what works for me maybe can't work for you. And maybe you don't want to be a mom. That's not an obligation. You want to do what you want. Like, and if you are happy, you're doing a great job. If your patients are getting well, if your kids are happy, they're having a being succeed in life, and that's the thing.
That's great, Tatiana. We are so proud of you for your leadership for the Dengue Society. I cannot thank you enough. We're proud of you for the respected neurosurgeon you are in Brazil, and for the amazing family that you have. It's been great to have known you this whole time. Next goes to Ahad. Who is your question to?
My next question will be for Dr. Samia 𝙊𝙤𝙚𝙪𝙪.
Okay, allow me to say a few words, Dr. Samia 𝙊𝙤𝙪𝙪. We're glad to have you with us. I have never met you in person before, so it's great to have you on this panel. You have an amazing story, and I think it's important for many of our audience to hear your story, because that's a story with many people in this generation gonna be dealing with as they move from country to another for their training. You are from Lebanon. You come from a very proud family in Lebanon. You attended Holy Spirit, USEK in Lebanon, and a very respected place. You went to Notre Dame Medical School, very respected medical school, and you started your residency in Lebanon. And then for the last 2 years of your residency, you moved to complete your residency in France, in Paris. At St. Anne Hospital, all very respected places. And you have done fellowship, and you are a skull-based surgeon now at 𝘿𝙤𝙤𝙪𝙪 Hospital. So you have done research, you have done fellowship, you achieved what we call success in neurosurgery, going from one culture to another, going from one country to another. So what is the question, Ahad, you have for Dr. Samia?
Yes, so Dr. 𝙊𝙤𝙪𝙪, learning that you've moved from your country to another country, and since many medical students in general, and females in particular, plan to study abroad, what did you find it challenging when relocating in order to finish your residency and complete your career in France?
Hi, Ahad. Hi, Salim. Thank you for the introduction. I had just a small hello because we're both Lebanese. For me, it wasn't that difficult. I come from a French-speaking country. I went to a French-speaking university, a double-speaking university, but I speak French. It's my second language. So the cultural change wasn't different and wasn't shocking. What was difficult was moving away from your friends, from your family, just relocating to the other end of the world. And well, I came with a plan, and that plan changed along the way with what is happening in Lebanon. But the move in itself wasn't very difficult. On the contrary, it was exciting. And I guess it's the same for a lot of people around the world, because I think at some point during your residency or after your residency or your fellowship or where you will be working, you will be moving at some point. I understand this happens a lot in the US. You train, you do your med school in one place, you match in another state and move a few hundred kilometers away. Then when you finish your residency, you're gonna do your fellowship, and then that's another step. So that wasn't really difficult. What is a little bit challenging is when you want to, go to the next step. France has a specific system. You can, if you are coming from anywhere in the world in general, you can come do a part of your residency, but after that you cannot work in the country unless you go through the equivalent of the American board certification. It used to be an exam. Right now they are changing a little bit the rules. So you just have to know what you want to do early on, because if you want to, after your residency, if you want to do a fellowship, you should do the exam early on and pass the exam evidently, or else you will not be able to do a proper fellowship in a proper center in Paris.
Well, thank you, Samia. You've made a great career. You're establishing yourself in France, and all of you guys will be mentors to many of our students watching you right now from around the world. The next question, Monica, who is the question to?
Yes, the next question is for Dr. Nan Tsujijantharat.
Oh, okay, Monica, allow me to say a few words. Nan is the only resident representative on this panel, so she's got a lot on her shoulders, but believe me, she is very capable of handling it. I've known Nan a long time, actually, all her career. Nan was a medical student with us here in St. Louis, and really her journey defines many of the things we're talking about here today. When Nan was a first-year student, we were just establishing the clubs program for the Dandy Society, and I remember she attended the first Neurosurgery 101 course that we put together. And I got to know her from that time. And her interest developed in neurosurgery. And just to say, that Nan and Monica are just few years separated from the same medical school. And Nan was an exceptional medical student. I was so proud that she went to Yale for her residency, with great professors. You already met Veronica, excellent people at Yale, and she's a resident there. And her faculty have told me a number of times over the last couple of years, she's an exceptional resident. And we did not think it would be any different, So yeah, please go ahead, Monica, ask your question.
Thank you. Dr. Nan Tsujijantharat, as a neurosurgery resident, how have you managed with all of the stress, balancing important relationships in your life, friendships, family, while still advancing your neurosurgical career and beginning it? What is your view on the whole situation?
Hi guys, hi, thanks for having me here. And let me just start by saying, if it wasn't for Dr. A, I probably wouldn't be in neurosurgery today. I was fully intending on going to GI. I went to that.
Alguém dá almoço para ela, gente?
My dog is whimpering in the background too, so I can.
That's part of this. This is important. This is real life. Okay, I like it. It's okay.
Yeah. I'm probably not a very good person to answer that question, only because, I moved from Thailand. My whole family is in Thailand, and I'm fortunate enough to have a very, very supportive family. Most of the important relationships in my life actually in the United States are my co-residents, and Dr. Chang was right on. These are the people that know you the best. They know you at your absolute worst, because there's nothing worse of you than when you haven't slept for 30 hours and everybody is just a bad person to you and you're cranky. So we have a really good group here at Yale, so we hang out together a lot, of course, pre-COVID, and we're there for each other. I will say though that my experience in residency really is a testament to the work that people before me have done. And that is, when I came to neurosurgery, when I was going through an interview trail, it never occurred to me that things should be different for me as my male colleagues. And I never thought that I wouldn't be able to do anything that my male colleagues would be able to do. Of course, as you go through that experience, you realize that there are things here and there that are a little bit different. You kind of appreciate those aspects. So, these are the things like, when you go to interview, and I hope it doesn't happen anymore these days, but I remember going on interviews and some residents would tell me, oh my God, like we don't have any female residents. We hope we would get female residents this year. And then you just kind of feel, oh, okay, great. It's a little bit different. Or I remember my interview with Dr. Marasco, who at the time was the only chairwoman in the country, in the United States. And I was fangirling her very, very hard. I was so excited. I walked into the interview and I remember within the first 3 minutes, she told me, you need to freeze your eggs. I was like, okay, I didn't see that coming. But these are the things that, you didn't realize that it was going to be different, but it was different. It's not bad or good, but it's just different for you. And you learn to adjust. And these are the things that, hopefully in the future going forward, it isn't a thing anymore for a future generation. We're already starting to see the turn. We're interviewing a lot of female candidates this year. And, hopefully one day it'll just normalize.
Well, that's great. That's great. Now, and I want to ask you a question, just to go back to what Veronica said earlier. She and I and Catherine in the United States, we went through the time just before the resident hours changed, so we had no limitation in hours. Now, you live you are now experiencing Now, I don't want to put you, get you in trouble. I just, so you don't want to, I'm sure you're attending, say, yeah, we had a lot harder or whatever. Do you think that's true or not really true? You think truly things have changed or not really? And I know you have to be careful because you don't want to say anything that, about the hours or whatever, but just give me a general gist, how do you perceive it?
I think oh, sorry.
Go ahead.
You go.
Okay, somebody else was going to say something?
I was just going to say that for sure things has changed. I can see it.
Okay. Okay, Rebecca said, okay, Nan, what do you think from your perspective?
I think so. And the 80-hour work week, I think we're pretty good here at Yale. I would start with that. I think we were pretty good in adhering to that standard at Yale, but whether it actually succeeded in implementing an absolute 80-hour work week for resident or not, what it does, I think it shifts the culture and the way of thinking a little bit in this generation. And I think there will probably be people who say residencies today are not made the same way as residents back in the day. But I think what it does is it's kind of the side effect downstream is it makes you think that it's okay to take care of yourself too. It's okay to go home and sleep. It's okay to think about your life in the long run. But because you can't be a good neurosurgeon if you don't take care of yourself, if you're, always sleep deprived, if you're always kind of struggling to stay awake. But that's what.
Yeah, that's very good, Nan. Actually, what Nan is saying is true. I mean, her program is sticking to that. I don't believe across the board neurosurgical programs in the United States are all adhering to those resident hours. And, we're not saying any names, so it doesn't matter. But in neurosurgery, that culture still exists. So what people have written in paper versus what's really truly being practiced may not be the same thing. But even when you compare that to other places in the world, 80 hours, which is a current required, is a lot higher than a lot of other countries, which are down to 50 hours. So it's a huge spectrum, when you look at that, from that perspective. So that's, Nan, I was proud of you when you were a student. I'm proud of you today. It's so great to have you with us. Okay, next we're gonna go to Ahad. Who's the next question to?
The next question is for Dr. Nicolina Cejic.
Well, let me say a few words about Nicolina. Nicolina, it's great to have you with us. Nicolina was the first female neurosurgeon for the country of Croatia. So it's a great to have her with us here today. Nicolina, I know her well. I know her family. I've met her parents. She has two little ones, cute babies. She has Dante, who's 4 years old now. And Angelina is only one. And because of COVID, I never got to meet Angelina, but she's so cute. Her husband, Vedran, is a good friend of mine. So it's again, she's somebody I've known a long time. And she has been to visit me. She has seen some of the work that we do here as well. Her goal is now further evolve her career. She's planning to do a fellowship in functional neurosurgery in the United States. So she is, despite all the things she's dealt with, she's kept her career, to go for her goals. So it's really great to have Nicolina with us here today. Ahad, what is your question for Nicolina?
So, Dr. Cejic, as Dr. Abdulrauf just mentioned, you are planning to further evolve your career and do a specialized fellowship in functional neurosurgery. What are some of the obstacles and struggles you have faced, being that you have a family and you are planning to move to the United States for advanced training? And what are the challenges you are facing and how have you sought to deal with them?
Okay, so first of all, there's so much to say. Thank you for inviting me here. I feel really honored to be with you. So I had really an extremely great quality of residency in Croatia. And it was a matter of luck and also some unbelievable circumstances that I got into neurosurgery, which I didn't know a lot about before starting it. And it was really difficult. I should say it was difficult for me as it was for my male colleagues. And I don't think it was any different for them as it was for me during the residency per se, because at the time I didn't have a family and I only had neurosurgery. I mean, during residency, I didn't have that much of a private life, I should say, and most of you probably understand. And after that, my career developed in a rather peculiar way, because I decided to pursue a fellowship in the United States. And at the same time, I got my two babies. First, I got my son 4 years ago and then a daughter. And in the meanwhile, I was studying for board exams, for USMLE exams, the STEPS. And as I was doing that and dealing with two small children at home, it was really, really difficult. I wanted to spend some time with my kids, to be with them for the first years of their life, and trying to be a mother and a wife and also studying. And it was really, really difficult. When I look at it now, a few years ago, this was happening a few years ago, I cannot even believe how did I manage to do all these things. And this path is not finished yet, because I have so many more tasks to do before coming to United States and getting my visa and so on. But regarding the obstacles, I would like to say this, that I agree with one of the colleagues that said that you don't think about yourself as a part of the group that typically represents a stereotype neurosurgeon. For example, when I was doing symposiums and traveling around, I was always hanging with the wives of neurosurgeons, because I didn't think of myself to be, to fit in there with the old guys. But little by little, I got used to it, and I matured in this way. And I realized that not all neurosurgeons must be the same. And I was here to break the stereotypes, even though I didn't have a role model in Croatia, because I was the first neurosurgeon. And for quite a time, I was the only female neurosurgeon in my country. So the obstacles now are much, much greater than they were during the residency, because being a mother is much more difficult than anything. I don't know if you agree with me, but I would even argue the difficulty of being a mother with the difficulty of being on call all the time, without a pause, like not 72 hours being on call, but being on call for 4 years. So you never know what will happen and who will be sick and who will vomit and who will have a high fever or what will happen next. So it's, I haven't been operating for a year, because I was staying with my little one, but just recently I got back to work, and now I'm trying to figure out the things and balance the situation between private life and my career. And I already see it will be very, very difficult. But I survived, so if I survive, I guess a lot of people can do the same. And I have always been thinking that a very big part of my career was to encourage other young students, especially girls and especially young female residents, to pursue this path, because even though it's very difficult, it's doable. And you don't need to be superhuman. You just need to be very, very devoted. And also, even though I think there is a need for panels like this and groups like this, I don't think we should be connected only on the fact that we are women, but also just this common devotion of following neurosurgery should be the binding force for us, not the affiliation to a specific race or nationality or sex or anything like that.
Those are great words, Nicolina. Thank you. Thank you so much. It's so good to see you, and we're proud of you. Next question comes from Monica. Who is the question to, Monica?
Thank you. The question is for Dr. Anila Darbar.
Of course, yeah. Allow me to say a few words. Dr. Anila Darbar is somebody I've known a long time. Anila is originally from Pakistan. She did her neurosurgical training in the United States, in New York. Then she did a fellowship in minimally invasive surgery in Australia. And of course, she did the best fellowship you can ever do in the world, which is come and did a fellowship with me in the complex skull-based surgery in the United States, back to the US. And then ultimately, Anila went back to her home country of Pakistan, where she is a leader of neurosurgery in her nation right now. She plays a big role for the role of women in neurosurgery in the continent of Asia, as well as in her own country. Besides being a neurosurgeon, she also plays a role in administrative leadership. She's a medical director of the 𝘿𝙗𝙨𝙪𝙪 Hospital. So she has a lot of things on her plate. I think she kind of typifies what people can achieve in this field. And just from a personal level, I've seen Anila grow, and I'm very proud of her. When she was here with us, our dad came to visit. I got to meet him. So these personal connections mean a lot to me. So go ahead, Monica, ask your question. Please, could you put your audio on mute until you speak, because we're hearing background noise. So all the panelists, if you put your thing on mute until you speak, please. Monica, go ahead and ask your question.
Great. Thank you, Dr. Abdulrauf. Dr. Darbar, whether we regard the stereotypes or not, we understand that Pakistan is a more conservative nation with more limited female rights. How have you, as a neurosurgeon, reached such a great leadership role in your country, and what challenges have you faced in achieving this?
Thank you, Monica, and thank you, Dr. A, for inviting me on this panel. When I had left for United States, they were very, I think there may be just one female neurosurgeon in Pakistan at that time, who had actually already had left for Canada. And by the time I had come back to Pakistan, the first thing that I had noticed was that there were very, very few female residents in Pakistan who were doing neurosurgery. And so I got along with the Pakistan Society of Neurosurgeons and started a Women in Neurosurgery chapter. And we did a lot of talks in which I would invite some leading females from around the world who would come and give the talk. And the whole idea was to motivate the female medical students and provide them with different kind of role models to see that, if we can do it, they can also do it. And I then became a program director for my own neurosurgical program where I was working. And I started hiring female neurosurgeons and female residents. And the thing was that when I went there, all the medical students, even in my university, they saw that I was a neurosurgeon. A lot of them wanted to come and do electives with me. And this sort of started rolling the ball. That's what I said. And this all started in 2013. I graduated the first female neurosurgeon from my program. And now almost there is like one female who is, we have a program of 2 to 3 per year. And usually at least there is one female who is taken amongst a bunch of them. And the Women in Neurosurgery chapter in Pakistan also helped not only to motivate the young girls, but also to sensitize the neurosurgeon males in Pakistan that, there are female neurosurgeons around the world who are doing good work. They are as skillful in research, in academics, in neurosurgery as their colleagues and the counterparts. So this was one of the things that I started. And I'm so happy to say that currently we have almost 45 female neurosurgeons, female neurosurgery residents around in Pakistan. And almost now there are 11 of them who have become neurosurgeons, trained neurosurgeons in Pakistan. So I'm very proud of Pakistani female neurosurgeons that they have taken up the challenge of doing neurosurgery and are coming into this program. The few obstacles I would say that I had initially faced, and I still remember during my early days in 2013 when I had joined in, was again, then since the hospital has never seen a female neurosurgeon, so I felt, I call it a triple whammy, not a double whammy, but a triple whammy, in which not only your colleagues, but your faculty, your colleagues, your patients, and their relatives, every one of them actually question that whether you will be able to do a certain procedure. So if I would schedule somebody, I would have noticed that many a times the family would go around, ask one of the male colleagues, even a resident male colleague, asking them, do you think she is capable of doing this surgery? And this was the initial challenges that I had faced. But what I wanted to say now, 8 years later, is I do not face that challenge anymore. And the reason is because I think in Pakistan and any of the third world countries, when the word of mouth spreads into the community, then you are the only one they want to come and get operated. Now, when my patients or their colleagues, they see me as Dr. Anila Darbar as a neurosurgeon, and they don't see me as Dr. Anila Darbar as a female. So the whole idea, I have seen it in the last 7 to 8 years, how the whole shift has happened. And since more female residents have come into neurosurgery residency, now even in the university programs, people are used to understanding that there are female neurosurgeons, and this question whether they are capable of doing the job or not is almost finishing up. So I think that was my biggest challenge that I had. My latest biggest challenge is that I have just joined as a medical director of a brand new hospital. And so now somehow after taking up this job, I feel neurosurgery is probably easier to do. And first time in my life, I realized that the most difficult people to deal in management are the doctors. So, but this is also a good learning process. The reason I chose this job was because where I am located, it's not a big city. It's a very small city in a remote town in Pakistan. I have no family here. And the only reason I actually took up this job to bring neurosurgery here. There are not good neurosurgeons here. I am developing a neurosurgery department here. And people are now understanding that this is a place that's offering good neurosurgery. And this was my big goal in coming and setting up a neurosurgery practice in this little small remote town in Pakistan. So I hope that I am successful in setting up a fantastic neurosurgery department, and my nation and my countrymen can benefit from this endeavor. Thank you.
Well, Anila, they have benefited already. You have changed the opinion in just your first few years of a whole country, how they look at neurosurgery. So you alone, singularly, see, this is what we're trying to tell all the students around the world are watching this. Leadership is about singular people who stand up at the right time in history to do the right things, okay? They could be male or female, whatever, but this is what true leadership is about. What Anila, in a very humble way, just told us is really the story of what true leadership, visionary thinkers are about. You know, she has changed the path for all other female students who want to go in neurosurgery in Pakistan. One single person has changed that path. So this is what we are trying to really teach students around the world through our program, is really teaching leadership and how you think. So we are indeed very proud of you, Anila. We're very, very proud of you. Next question is Ahad. Who's your question for?
Yes, the next question is for Dr. Caroline Apra.
Oh, great. I'd like to say a couple words about Caroline. Caroline is a French neurosurgeon, and she had a very interesting path. You know, she was an engineer. And then after that, she decided this was not exciting enough for her. She decided to go to medical school, and that was not exciting enough. She wanted to go into neurosurgery. So, and that has been her path, okay? She had done her medical school and training in Lyon and in Paris. And she also then, all of that is not enough. She also had a PhD in genetics. So she has done research. And she is an attending consultant neurosurgeon in Paris now. She is, her area of specialty is skull-based surgery, both endoscopic and open. I have never had the opportunity to meet her in person, but we will for sure. What is your question to her, Ahad?
So, Dr. Apra, I understand you've done many research in the field. Can you give us some insight on how can female medical students create more opportunities for research in neurosurgery during their medical schools?
Hello, everybody. Thank you for inviting me. I'm very honored to be here. Thank you for your question. Research is indeed really important for me, especially because it makes the difference between neurosurgeons and leaders in neurosurgery in France. If you want to be an academic neurosurgeon, you have to do a lot of research. And I've been struggling to do this whenever I could. I think doing research when you're a medical student can be challenging because you have to find your own path. I don't know, probably it's very different in different countries. In France, there are several ways of doing it, and probably the best one is to probably read a lot and know a lot about what really interests you in the field of neurosurgery. And you can always discuss with people who've been publishing before you, and we've been talking about role models. I think meeting with people, with neurosurgeon or with researchers you admire and whose work is really interesting you is probably the best way of becoming a junior researcher when you're a medical student. I know in France, in my faculty, it's very easy if you send an email or you call someone and you say, hello, I'm a medical student. I'm really interested in skull-based surgery, for instance, or genetics or anything. People will always be really interested in offering you some kind of research job, and then you can prove that you're really a brilliant medical student and that you're really interested in it. So I think you really have to be active and try to do that. And I feel that for this question, being a female probably doesn't really make a difference, but maybe it depends on the people you're talking to.
Thank you so much, Caroline. You know, what you're doing in your generation in France, you know, in France, they just started a young neurosurgeons group for France, which is really great. And it is something I have been really interested in around the world, is that our mentors, and I love all of them, they're amazing men, but we do need this younger group leadership, and that's why we created the Dandy Society. And I'm just trying to, I'm really happy that many countries are doing the same thing, and I'm glad that France is doing that as well. Next question is Monica, who's your question to?
Yes, my next question is for Dr. Rebecca Perez Alfayette.
Great. Let me say a few words. You know, many speakers on this panel, my whole career in neurosurgery touches with them, and Rebecca is one of them. I've known Rebecca for most of my professional career in neurosurgery. I remember I was just a junior faculty, went to give a lecture in Spain, in the beautiful, at one of the Congress in Spain, and I got to meet Rebecca when she was just finishing her residency. Rebecca came and did a fellowship with me here in the United States and spent time with us. We got to know her very well. She did an amazing job. She really was, she witnessed the awake surgery for vascular and skull base when I was just starting that. She saw a lot of that work. She went back to Madrid. She's a consultant neurosurgeon. She went back and completed a PhD in AVMs. So she is truly an academic neurosurgeon, a leader in neurosurgery. I got to know her and her family. She actually has a twin sister who looks exactly like her, which is great. And her twin sister is actually a dentist and an oral surgeon. Just a great family, and it's just been a great thing for me to have known them. And I've known Rebecca. I truly am proud to say that I have been a mentor for her, as I have been to a number of people on this forum today. So what is your question for Rebecca?
Great. Dr. Alfayette, it is known that Spain is one of the most progressive countries when it comes to female physicians in neurosurgery. How did this model in Spain develop and allow more female neurosurgeons to enter the field? And what are your opinions of the system? Are there any challenges you foresee? Oh, I'm sorry, Dr. Alfayette, you're muted.
Can you hear me now?
Yes, now we can hear you.
Okay, thank you for inviting me here. For sure, Salim, he is my mentor. My mentor is him. You know, since I was in my second year of residency, I saw him for first time. I said, I want to be like him. You know, I want just 1/3 of where he is, I will be happy. You know, so
you will be better than me. You will be better than me. Please.
I just want to be like you. No, seriously, he is, you know, one of the most challenging people that you can know and meet, and he can drive you to get your best, seriously. So I really recommend you guys to, even if you just can do an observership with him or something, just do it because it deserves it. So, well, for the residency in Spain, why we are more females here? Because, well, in Europe, we have other concepts, okay? We are more protected women since, 40 years ago. So that's the thing. But the point in Spain is for getting in the residency, you don't need to go through any interview. You just take an exam. It's a very, very, very hard exam, but you get your score. And that's it. It doesn't matter. You get a score. The first score is the one who is going to choose the specialty. I want to do vascular surgery in Barcelona, 𝘿𝙗𝙪𝙧. Second person is going to choose neurosurgery in whatever. So it doesn't matter who you are. You're going to choose your position. It's not, no one is going to tell you if you can do it or not. So it's all about what you believe you can do. That's true that what other colleagues were saying before, in the med school, even in the residency, your colleagues, all of them, they are male. Even when I choose neurosurgery, my colleagues in the med school were saying like, what are you doing? Why are you not in dermatology? Or it was like, you go to dermatology. I don't want to do that, okay? So, even your colleagues think, but it's because it's a very hard specialty, because you need to dedicate a lot of time. I think that only the residency is not time enough to learn to be a neurosurgeon. You need more time. You need fellowships. You need experience. You need to have a mentor. Even me right now, sometimes I comment some cases to Salim. I say, what would you do with this? Because it's a very, very, very long, hard specialty, and it's very challenged. And, most of the people want to be comfortable in their lives. I think it's not only about male, female, because I'm not a mother, but just because I feel being a mother is very difficult, not because I'm a neurosurgeon. Even if I will be teacher in the school, in primary school, I will say the same, being a mother is very difficult in my opinion, but that's my opinion as a person. A father, for him, he has to spend also time with their kids. If they have it, he has to spend time with their kids. So I think we need to really believe that we can do it. It's not because I'm a female that is more challenge for me to be a neurosurgeon. Neurosurgery is a very, very, very challenging specialty. That's it. You know, and we really need to stop thinking. That's something that I really learned when I was with Salim in St. Louis. You know, when I was in my residency, trust me, girls, I really had to work 3 times harder than my male colleagues for look the same, because I was always pushing like, yeah, well, Rebecca, I was, you know, it was very difficult for me. They were going for doing any research, and after that going to make a soccer game. I was never invited to all of that. Since I arrived with Salim, chicken wings party, soccer games, everything. We were the same, girls and boys. We were absolutely the same, no differences at all. So that's something that you really need to believe it. I am the same than whoever. You know, I believe and I trust my ability. That's it. When you trust it, everyone see it. Nowadays, I get in a room to visit my first time a patient. I'm the vascular surgeon here. Okay, I'm going to perform this surgery. No one have any doubt because I show it. I just, you know, I show it. I'm the same. Who is going? No, you know, in this department, I'm the best to do this surgery. That's it. I believe it. That's it. So when you believe it, people believe it. The problem is when we have the mentality all the time, oh, we poor girls, my God, oh, God, guys, they are lucky because they don't. No, stop thinking that way. We need to change the mentality. We really need to change it. We, all of us, we are the same. Neurosurgery is difficult, that's it. If you have the challenge, it doesn't matter if you're male or female, it doesn't matter, okay? And being a mother is difficult, I think. That's why I'm not, okay? So, but it doesn't matter if I'm a neurosurgeon or not. There's something that you know, you always have time. I have time to spend with my friends. My friends understand my lifestyle. I spend time with my family. You know, I do my life also. It's nothing, you know, I really love what I do. That's it. So,
Rebecca, we are so proud of you. I just want to make sure you know how proud I am of you. My words cannot be enough. But what you say, the way you talk, is really what it is. It's what it is, and your confidence, and regardless whether you're male or female, those words mean the whole world. Okay, so thank you for that. As we're coming to the end of this session, we got tons of questions on YouTube and Facebook. There is no way we can get through them. So make this easier. I'm going to go around the panel, and I'm going to ask one simple question, and I would ask each one of you to say a few words. And this is a question I'm going to ask you. We have students, both male and female, watching this session. If you had one advice to students, regardless, they're male, female, whatever part of the world they come from, what is your one single advice to a medical student who's thinking about going to neurosurgery? Okay. So let me start just as the panel shows up on my thing here. So Samia, you first, please. One advice to medical students from around the world who are watching us today, who are thinking about neurosurgery.
I have to agree with Reka. It really does make no difference if you're a male, if you're a female, if you are gender, do not prefer to specify. It's not about your gender, it's about your capabilities. It's about believing in yourself. Neurosurgery is hard, and we've earned the right to be here with our scores. I come from somewhere where there are no interviews as well. I was the first woman to do neurosurgery in my first country. It doesn't matter if we're female or not. And as she said, you have to believe in yourself, but you have to work hard. Do not expect to become a good neurosurgeon without working hard. And working hard comes on different levels. You have to study. You have to learn your material. You have to go to surgery. You have to observe. You have to train, whether on cadavers, if that's still doable in your countries, and during surgeries. you have to have good mentors. You have to ask questions. You have to learn from others. You are not alone, and the field of neurosurgery is difficult enough. And lastly, always leave a space for other things. Do not be overconsumed with this specialty. We do not have work hours like regulations in France. I don't know if it's the case in Europe, but we do not have work hours regulations. We can work nonstop. And I love my job enough to do that, but we'll have to balance your life. So yeah, I overstepped and gave you a lot of advice, but then just believe in yourself, work hard, and leave space for other things.
Thank you, Samia. Anila, one advice for medical students around the world.
So, in this part of the world, a lot of medical students want to go to the US or UK, and they want to pursue neurosurgery over there. So my advice to anybody who wants to go out of their country to US, UK, or Australia to pursue neurosurgery, the most important thing is planning. So do not think that you're going to finish your medical school and you're going to apply there and you will be able to get into a good slot anywhere in the US or in the parts of the world where there's good neurosurgery residency program. So my advice to the medical student is start planning the moment you know that this is what you want to do, and have a mentor who can actually guide you. Do electives and observerships in these in different parts of the world, so they know you. You also know what's happening. Do the research papers. Have a good CV. And your CV should not only reflect academics, but your CV should also reflect a part of your personality as well. So do extracurricular too, and have an very all-rounded CV to present to the world. So this is my advice to them.
Thank you, Anila. Kathy, same question for you. Your advice to our medical students around the world.
So I think what Samia and Anila said was very important. It's very important to early on find a mentor and communicate with that mentor regularly, not just at the end of your chief year, to communicate regularly and get real feedback from them about your progress. That's so, so important. And nowadays, especially with virtual Zoom and everything, that should be an opportunity for you. I think it's very important to volunteer in your local, state, country, and international neurosurgical societies. Very early on in my career, I became involved with the Congress of Neurological Surgeons. And as I volunteered to help in more committees, I was eventually the committee vice chair, and then the chair of the committee, and then you find yourself on the board. So growing up in neurosurgery, the first time you go into a boardroom filled with senior neurosurgeons, you might be a little bit intimidated and not speak up. But as you have more experience, you find your voice. So then when you're at the board table and 99% of the people there are still male, you have no problem standing up and speaking your opinion and stating what you believe in. It's also very important, I think, as Anila and Samia mentioned, to find your area of interest in neurosurgery and develop that area of interest and do research early on and have a mentor who helps you get published. It's so important for your CV to show that, yes, you have interest, yes, you do research, yes, you volunteer for different committees, and that you are active and engaged in the neurosurgical community around you. So even doing this, all of this should be on your CV yesterday.
Thank you so much, Kathy. Nicolina, an advice to medical students. Your audio.
Okay, so my advice specifically for students that haven't yet decided whether to go to neurosurgery or not. This can all seem very overwhelming, listening to all these advices, to do all these things before even thinking about the residency. But for students who are not decided yet whether to do it or not, my advice is not to listen to anybody and not to listen to any kind of prejudice-filled stories, but just be confident and just try to find this belief in yourself and to follow your instinct and just go for it.
That's great, Nicolina. Thank you. Caroline, advice for medical students, please.
Well, so many things have been said already. It's hard to say something else. The most important thing, I think, is to work hard and find a good mentor. And probably the way to do it is to really enjoy and love what you do. So whenever you do something that you're not enjoying anymore, probably you have to ask the question to yourself and to discuss it with your mentor or other people who you want to, like your role models around you. And what am I really liking in this job or not in these studies? And I think neurosurgery especially, but all medicine is really, really wide. And there is always an area of interest for everyone. Maybe what you like is, you know, contact with the patients. Maybe it's microsurgery. Maybe you like to develop robotics stuff. Maybe you like radiology. There are so many skills that you can develop that you have to find something you really enjoy so that you can work hard and be the best in it.
Thank you, Caroline. Tatiana, your advice for medical students.
Actually, I would like to make advice for actually all physicians, doctors, and things like that. That's not stop seeing your patient as a human being. Look for them, look what they want, look what they want with their lives. Don't put a surgery as a pattern that's going to fit for everybody. I did awake surgery, and I always ask my patient what are their boundaries, what are their limits, how they want to live. And I think that you need to have this kind of view to see our patients, what we are doing, what we are working for. Maybe that's the thing, that never stop saying that you have another human being in front of you.
Thank you, Tatiana, for those nice words. Nan, you are the last person to give it. You are the freshest person out of med school and residency. How do you reflect back? How would you advise students coming behind you who want to think about neurosurgery?
Well, the process for me wasn't that long ago. And so I remember acutely thinking about this because I had to do a 180, thinking about going into neurosurgery instead of GI. And my advice would be, you know, I think a lot of times it's really easy, especially for people who are attracted to neurosurgery, for us to overthink things. You know, in my mind at the time, I thought, you know, what if I go into neurosurgery doing all this work and I find out that I have 2 left hands? What if I'm not good at it? What if I don't have, you know, enough of a resume to go into it? I think the better approach to med students and just in life in general is you make a decision, you commit, and then you find a way to make it happen. I think that's, to me, has carried me far, and I think it's applicable to a lot of things in life.
Indeed, great advice, Nan. Thank you for that much. I'm gonna share my screen again as we come to the next. So I'd like to just a word to all of our clubs around the world that have joined. These are all the countries that have the Dandy Medical School clubs that put this event together today. And some of these clubs are still in formation, some are fully active. So if there are students who are watching this from around the world who do want to be part of this process, I think Ahad and Monica will tell you how to contact, and please be part of it from that standpoint. I would like to really say a word about the students who, the members of the specific committee that made our specific session happen today. They've been working on this session for weeks, actually, an amazing group of people that I want to recognize. Of course, I want to recognize Monica and Monica and Ahad as they are the co-chairs of this committee that just put this together. And as you saw, they did an amazing job. Mahendra from Nepal, Shital from Nepal, Kiriaki did all the work for YouTube for us. She's been working really hard. Thank you, Kiriaki. Sofia from Argentina, Justine from Brazil, but going to school in Argentina, Max from Romania, Anatol from Austria, Pavia from India. See, I gotta move my screen, okay. Rachel from Germany, Hassan from Algeria, Pedro from Brazil, Ala from Egypt, Rosie from Nepal, Mohammed from Lebanon, Stoika Iwana from Romania. I'm just trying to move my screen so I could see everybody. Okay, Clara from Germany, and Zainab, who put all these slides together for these talks today from Lebanon. Unfortunately, there are a few students whose pictures we don't have. I apologize. We will recognize them in future sessions. But this is the operations committee for the dandy clubs around the world who are doing a lot of things. There are going to be future programs that will be coming together as this committee works hard in doing this. And their sister committee, the strategic committee, is currently working on identifying the World Congress of the clubs program that will be held somewhere in the world, and they are working on defining that for us very soon. So it's an amazing group of people that we have here. Since I have the bully pulpit here, I've written 2 books in neurosurgery. I want to share with you a book that I've always wanted to write all my life, and finally came out. It's called 3 Invaders. I want to share 30 seconds with you because I just want to share this with everybody, given that I have the opportunity here, just to tell you about my book that I always wanted to write. So this book had been my dream to write, finally came out. Neurosurgeons are truly leaders in their communities. They're leaders around the world. Many neurosurgeons have played major leaderships around the world. So this is my input about some of the larger issues around the world. I want to introduce you to my advisor, and many students around the world know Tank, baby boy Tank. He's very famous around the world. That's him right here, and he wants to say hello to all of you guys as we come to an end of this session. He knows many of the people watching here, both on the panel and around the world. He's well known around the world. I'm going to turn it over to Ahad and Monica to bring a close to our session.
Thank you very much, Dr. Abdulrauf, for the whole webinar today. We would just like to thank our sponsors, the Walter E. Dandy Neurological Society, as well as the Abdulrauf Institute of Neurosurgery for making this webinar happen today and supporting us.
Thank you everyone for tuning in today with us. We know there are a lot of medical students around the world watching this. and we are opening the door to form clubs in many countries. So for those of you watching and wish to form a club in your country and join the Walter E. Dandy Society of Neurosurgery, make sure to send an email to this address below. And thank you.
Thank you, everybody. It's been great. We hope to see you all soon again. Thank you very much.
Thank you, everyone. It was lovely joining you.
Bye-bye. Thank
Bye.
you.
Thank you very much.
Thank you. Thank you very much.
Thank you very much.
Thank you. It was really a pleasure to be here. Thank you.
Okay, are we off the live session, guys? Are we off the YouTube? Angel?
Right now, do you want us to sign
Stop
off?
the YouTube and stop the Facebook, please. Yeah, I just want to say hello to our speakers, just to thank them.